Thank you, Mr. President. Tomorrow, President Obama is scheduled to sit down for an interview with a healthcare website called WebMD. The President is going to take questions about his healthcare law, and he's going to try one more time to convince people across the country that his healthcare law hasn't really been a complete disaster. It's a little bit ironic that the President will be doing this interview because under his healthcare law, before we know it, healthcare.gov is going to be linking directly to WebMD. People are going to have to spend a lot more time on websites like that one because the President's healthcare law is going to make it tougher for many of them to see a real healthcare provider. America is facing a looming shortage of doctors, of nurses, of physicians' assistants. When President Obama and Democrats were ramming Obamacare through this Congress, they focused on hiring IRS agents to force Americans to buy expensive coverage instead of training more doctors and more nurses to deliver care to patients. Now, according to the Association of American Medical Colleges, we're looking at a shortage of 90,000 physicians by the end of this decade. About half of those family physicians, primary care providers, and about half of them specialists. We see the same numbers, if not even higher shortages in terms of nurses. You know, there's an old proverb, physician, heal thyself. Well, apparently the slogan of Obamacare is now going to be patient, heal thyself. The old doctor-patient relationship is going to be gone. Medicine as we know it is going to continue to change. Even when you can get time with your doctor, you know, there's going to be a lot more of that time spent with the doctor looking not at you, but at a computer screen because of the law. And that's because of the burdensome new rules, the record-keeping requirements under the law. As more people try to get appointments with fewer doctors, some Americans are going to start seeing actual rationing of care. Here's how one economist described it in a blog post for the New York Times. Talked about the health care law's limits on payments to doctors and other providers. Wrote, if patients are lucky, the demand for doctors will be low enough that the limits will not matter. But if the new law results in a significant net increase in physician demand, the payment limits will help remind us of, as they say, Soviet-era limits on the price of bread with queues and black markets to follow. Now, we know that the President's website back this fall was a complete failure. 4 days before it was unveiled, the President said, oh, it's going to be easier to use than Amazon. The rates will be cheaper than your cell phone bill. You'll be able to keep your doctor. But again, the website was just the tip of the iceberg. People are seeing higher premiums, and it's interesting, Mr. President, as I was putting this together and looking about what remarks I had, I hadn't even seen this morning's newspaper today, Wall Street Journal, Thursday, March 13th. Sebelius, Secretary of Health and Human Services, says higher premiums likely in 2015. Higher premiums. What did the President promise? He said premiums would go down by $2,500 a family. So the website is just the tip of the iceberg. People seeing higher premiums now, and now our Secretary of Health and Human Services says higher premiums again in 2015. People have gotten notices of cancellation, over 5 million of those across the country. Many people can't keep their doctor. We're worried about fraud and identity theft that's been reported as a result of the problems with the website and ongoing. And then, of course, higher copays, higher deductibles, more money out of patients' pockets. Well, there was a new report out last week that brings this additionally to the fore in terms of concerns that people are having. And it's even from people that had supported the health care law originally. There was a report out last week by a major labor union talking about how bad this health care law is hurting its members. Now, to put this into perspective, Mr. President, this is a labor union that actually supported then Senator Obama and endorsed him when he was running for president a number of years ago. And they supported the health care law. And now it's come out with this union has come out with a report that says the law's unintended consequence, it says, will hit the average hardworking American where it hurts, in the wallet. If you actually go through this report called The Irony of Obamacare Making Inequality Worse, just to read from this, it says the ACA threatens the middle class with higher premiums, loss of hours, and a shift to part-time work and less comprehensive coverage. It goes on with examples of various individuals who are members of this labor union whose lives are being hurt by the president's health care law. A woman from the home state of the majority leader talks about her job as a housekeeper and how the website, if she tries to buy the Obama health care program, she says the website says that she would have to pay $8,057 a year more to keep the insurance she has now, and this is $3.87 per hour pay cut for her. She said, we work hard for our insurance. Why should we have to take a cut in pay for it? That's not what the president promised, so it's not a surprise that even the unions who have endorsed the president and have supported the law are unhappy with what they're seeing as the true results of the health care law. Now, the Democrat majority leader has said that all the horror stories about the health care law are untrue. Is he also saying that these union leaders and the people who have been made reference to in the union report, that they're lying? Is that what the majority is saying? Is that what the leader is saying? Is that what he's saying about a woman from his own home state? Well, according to media reports, the union said that the law will inevitably lead to the destruction of the health care plans we were promised we could keep. And people remember the president's promises. They remember what the president said. Everybody knows that the press has called the president's statement about if you like what you have, you can keep it, called it the lie of the year. More than 5 million Americans got cancellation letters from their insurance companies. It turned out to be so embarrassing that President Obama had to delay the rules that caused it. It's continued to be a big problem, so the administration is delaying the rule again. Not until just after the 2014 election, but with the potential going beyond the 2016 election as well. I mean, here we go, dozens of delays. Each one of these, this is the calendar of 2013, 2014, more delays to come, another delay, another lawless Obamacare rewrite. Well, the Obama administration continues to announce delays. We've seen one change after another to major parts of the law that are now politically inconvenient for the president. But Republicans warned that these were real problems, that they would hurt hardworking Americans all across the country. I was on the floor during all the debates talking about the problems to come with the health care law, offering solutions, offering suggestions. Every one of them was rejected because Democrats just didn't care. They only cared that at the second they realized that all their grandiose plans were actually causing more problems than they ever anticipated because they didn't listen. Look, the president had an event last week where he actually said that the law, as he said, quote, is working the way it should. That's what he said, working the way it should. Is that it's working the way it should after he made all of these changes? Is that what he means? Working the way it should. So if it's working the way it should, why has the president had to change it so many times? Does he not know what the rest of his administration is doing? Does he not know what the rest of this country is seeing? Is the president, is he delusional or is he just in denial? I think the American people want to know, and they deserve to hear from the president when he does this WebMD interview. When President Obama sits down to talk with WebMD on Friday, I hope that they ask him about all of these delays and the changes that he's making to the law. I hope they ask him about whether he believes it is really working the way it should, because that's what he said last week. I hope they ask him about how his health care law is going to reduce the time people get to spend with their doctors, if they can even keep their doctors. I hope they ask him about some of the ways that the law is hurting Americans and America. I hope the president answers that he is finally ready to make some of these delays permanent, to start over again, to work in a bipartisan way, to try to help patients get the care they need from a doctor they choose at lower cost. That's what health care reform was supposed to be about in the first place. I mean, it's so interesting. Just you pick up the papers, and day after day, yesterday, March 12th, health exchange sign-ups slowed in past month. That was Washington Post. New York Times, healthcare enrollment falls short of goal with deadline approaching. Signing up for insurance, but well below targets. And then today, interesting, because so many questions are asked of the White House and the Secretary of Health and Human Service, and the headline in Politico today, White House playing dumb on ACA enrollments. I think the President needs to come clean with the American people, tell them about what a disaster his health care law has become, how it has impacted their lives, how few people have actually been able to sign up or have been able to but have found that the cost is too high for them to sign up, and admit to the American people that when they talk about some of these numbers of sign-ups, many of those are just people who got cancellation notices. They're not newly insured individuals. The study out last week shows that only about 1 in 4 people that has actually signed up on the website didn't have insurance before. So the people this was intended to help, they're not being helped. Many people are being harmed. So it's time to work together, Mr. President, to help patients get the care that they need from the doctor that they choose at lower cost. Thank you, Mr. President. I yield the floor.